how do you feel? What do you feel the medical system could do to help us achieve that quality of life from the very first day when we go to the doctor? Like, what could they do better? Even if they don't know the diagnosis yet, even if we don't have the right treatment available, but in the physician-patient relationship, what could the doctors and the medical professionals do to help us live with good quality of life while we journey from the first appointment to getting the right treatment? Those years sometimes are decades. What could they do in the patient-physician relationship?
I personally think that they could say in the very beginning that we're going to figure this out, and not just, you know, push it aside and say, okay, well, you know, we'll run these tests or whatever. You know, that they need to look at you as a whole person and say, we are going to figure this out. And as you go through the process of figuring it out, you know, to make you more aware of what you're feeling at the time. And, you know, did you notice what was happening when you started to have those feelings? And talk to the patients more. Like you said, you really didn't have the time with your patients. And you need to have more time with the patients. You need to get to know them as people.
Yeah. So let me just repeat it to make sure I got it correctly, and then you can correct me. You said, Cathy, beautifully, we're going to figure it out, which brings hope into the picture, because we feel hopeless sometimes. This is scary. It's very scary. You said that they look at you as a whole person because the disease involves our whole organism and the environment. So really like looking at the whole picture. That they teach us, patients and clients, about aware a little bit of the physiological reactions to stress, aware of the connections between the different parts of our being, mind, body, emotions, aware of how the body works, do a little bit of education, and to allow us clients, patients, to talk and to share a little bit of what's really going on, not be so worried about, you know, clicking the boxes and asking the 10 questions they have to ask for all patients.
Or looking at your watch, I got my next patient, you know, not looking and just, you know, I need to get done with you, you know, and move on.
Yes, that's another part. So it's not only allowing us to talk as patients, it's also really listening,
Yes.
And then what your doctor did was be there with you. He was there with you. He took the time to be physically present, and also not say, please do not say, it's all in your head, or do not think, do not assume that, because it's such a complex disease. The head, the mind is just one portion of it.
Right.
Because there are the emotions, the physical body, and the environment. How physicians could improve the physician-client relationship and offer more quality of life throughout the journey.
Inquiring, not leading questions to take a patient down a path that may not be the right path, but inquiring questions and then listening to the answer. Instead of pushing, you know.
Yes, that's such an important point. Inquiring, asking those open-ended questions, like really being curious about the true experience of the patient, not leading. Yeah,
and
so important.
On those open-ended questions, it's also taking in the answer in a non-judgmental way.
Yes.
And responding with, oh, I can't remember what the term is. Wow.
Empathy, compassion.
Yeah, the empathy or compassion statements like, wow, Cathy, that must have been so intense for you.
Yeah.
Yadira, I know how much you clearly care about your family in Cuba and you care about your medical education. How can we help you get to where you're doing both? That's our goal.
Yeah, you're so right, Julie. And also because making the changes that can lead us to a healthier life are hard. Making the changes are hard. So the empathy is so important, and the non-judgmental too.
You know, we're done today, but I am your consultant for the rest of your life. Whenever you need me, I'm here.
Yeah.
That made me feel like the Queen of Siam.
That's so nice. Yeah.
And it certainly made me realize the difference between patient-focused, patient-centric care versus dismissive, you know, get this person off my list so I can get somebody else on it. Patient-centric, I mean, that's the buzz term.
Yes, yes, because you are right. At that moment, we have to be the center when we're there with our doctors. Because our lives are in their hands. My God. So we have to be the priority during those 30, 45 minutes, 1 hour, whatever time. Yeah, it cannot be the computer, it cannot be the watch, the patient before or the next patient. It has to be us when we go to the doctor at that time. Yeah.
And you know, for some doctors, like I think we talked about this before, Dr. Velazquez, I had watched something on FND, and the gentleman had said that these doctors, they don't know what it is, and that's scary to them. That's scary to them. They don't know, they don't understand, and so rather than try to confront it, they dismiss it because they're scared, because they're used to analyzing and making a diagnosis, and FND isn't like that.
It's not, yeah. I always learn so much, you know, and this is one of the reasons why I went from the mainstream medical practice to these programs, because I learned so much. FND patients have so much wisdom, so much. It's like, look at the conversation we just had. So many good recommendations. I'm going to share that. And I'm going to say that you do help me.